especially when I was a child, I had chronic ear infections quite a bit. And all growing up, I just have a lot of distinct memories about dual ear infections and a Boy Scout camp and having to come home from school sometimes, and even my parents having me lay on our warm dog because the dog was nice and warm, and I could handle the ear infections. And I went through a series of tubes, again and again and again. I grew up in Florida, but when I moved to Maine right out of high school, I worked for my uncle in a machine shop. The machine shop is not necessarily the friendliest environment for people, I guess, but friendly environment, the chemicals, and still had ear infections as I got older, 18, 19, 20, and into my 20s. And I was to the point where I had some substantial ear disease of some sort, and I had a ENT, ear, nose, and throat specialist that I found in Portland, and began treating me for ear infections, whether it was tubes or just antibiotics. And we built up to the point where in my left ear I had to have what's called a cholesteatoma surgery, a 7 or 8 hour surgery where they kind of cut your ear off, almost pull it back, and they removed the 3 hearing bones, hammer, malleus, stapes, removed completely, and built a new eardrum out of skin they took on the way in. Fascinating. Well, I was still going to this ENT, and after that I would still have this rising fluid in my ears. It would fill up, produce a lot of pressure in either ear till the tympanic membrane burst, and then it would leak, and that hurt quite a bit, but I would take antibiotics. And so the ENT, after 19 years or so, just threw up his hands and said, I don't know what this is. I think you should go see this a fellow that I know, Dr. David Hurst, and he'll tell it like it is. I mean, if he finds something, he's determined, he's persistent, and just go meet him. And so I did, and this was about 10 or 11 years ago now. And after an interview, talking about my story, he said that I have an allergy of some sort. I said, well, I've seen 2 allergists. They didn't really find anything. He said, well, give me a shot to look for it. He did a pretty exhaustive test through this prick test on my arms. It must have been 40 separate tests, just meticulously documenting and searching for what could be causing this otitis media or fluid in my ears to go up. And he was very forthcoming with information. In other words, it wasn't the kind of like, oh, you don't need to know that, here, let me, we got it from here. In other words, he was very detailed. As many questions as I could ask or even comprehend, he would explain it to me. So we about a year went by, and I didn't have an episode of fluid building, and we did that for a couple of years, maybe 2 or 3 years, and then they trained me to try to do my own injection, and he encouraged me to avoid some of my allergy environments, which was like mold and dust and cat and insect, whatever they were. But I did explain to him I didn't realize how much I like moldy things. Let's say blue cheese, red wine, beers. I didn't realize mold was in all of those things, and I lived in we're trying to go beyond the 4 weeks between any injections and just treat it completely with the decongestant if I have a cold or whatever. So we're continuing to push it even further, which actually was another refreshing perspective of Dr. Hurst. Is one of his main goals is to get you to a condition where you don't need him, which I thought was kind of nice. Either teach you how to avert your condition, or ways to treat it yourself. And again, that comes a lot with his willingness to convey information and teaching, and so he continues He's not just settled in a practice that is stagnant with whatever technologies and resistant to new. He embraces the new stuff, and I think that's very refreshing. First of all, I have the confidence to know I'm not going to be out at a camping trip or on a business trip or whatever and suddenly be inflamed with some searing pain of building fluid in my ears to the point where my eardrums burst and drain. That's not a fun week. It's not a fun day. It's painful, and and I can travel with the confidence to know that that's not going to happen. So I would definitely send him to Dr. Hurst for at least the initial consult and see where that takes him.